topic of healthcare professional well-being is all over the literature, and we know that healthcare professionals have been under a lot of stress, not just since the pandemic, but even before. And there's great interest in how we can establish structures to inform solutions, to connect healthcare professionals, not just with greater satisfaction in their job roles, but with thriving and flourishing beyond just sort of getting through. I'm Colin West. I'm the medical director for employee well-being for Mayo Clinic. I'm a professor of medicine, medical education, and biostatistics with a clinical appointment in general internal medicine, as well as in quantitative health sciences, where I work as a biostatistician. The title of our article is Charting a New Path Forward in Addressing Employee Well-being in Healthcare, which will appear in Mayo Clinic Proceedings. At Mayo Clinic, we embarked on an exercise to establish a framework for well-being solutions that was grounded in existing literature, but also really brought in the voice of all of the staff who work at Mayo Clinic so that we have a framework that resonates with the core values of our organization and what our employees value and need for their well-being support. And in this article, we describe how we created this model in partnership with our staff to develop a mission, a vision, and a strategic framework to support well-being across the entire organization, serving as a model not just for future efforts at Mayo Clinic, but for healthcare professions and organizations around the world. As we know, healthcare worker well-being is critical to our ability to deliver optimal care to our patients. There are evidence-informed models of employee well-being that have been developed by multiple organizations over the last several decades as we learn more about healthcare professional well-being and what is necessary to sustain and improve it. But there are areas of further amplification of these approaches that can resonate more strongly with staff in a particular organization. And so one approach to this is co-creation, where employees can actively participate in developing and refining a framework for employee well-being that affects those employees and also benefits them more directly. At Mayo Clinic, the employee well-being team, which was led by our first organization level medical director and the administrator of employee well-being, integrated employee input with existing well-being models through a comprehensive process, which allowed us to define a program structure that reflected the most important staff needs. The novel features of this approach can guide healthcare organizations as they will guide Mayo Clinic, as we work collectively to promote learning and working environments in medicine, where every member of the healthcare team can thrive. The key outcomes of this process were a unifying mission statement, vision statement, and a model with strategic focus areas and levels of responsibility. To get there, we first reviewed the literature on models for well-being and used our own expertise over several decades of work and that of the larger community to form models and elements that could be referenced by our staff as they then shared back with us what aligns, what matches our organizational culture, what resonates with their needs, so that we could iteratively integrate that employee feedback to co-create a model for employee well-being that was evidence-informed, but applicable specifically to the needs of our organization. That involved thousands of employees, each of whom had their own spheres of influence to socialize discussions, so that all of Mayo's more than 80,000 employees had an opportunity through no more than a couple of degrees of separation to weigh in on the employee well-being framework as it developed. This then evolved iteratively with various models that could then be shared with employee groups to get additional responses and reactions, with things as granular as minor word choices and ordering of elements, or even larger responses to, are there big themes that this actually doesn't include, or that may be overemphasized. The end result of this process over multiple months was a core statement around mission, vision, and a model with 5 focus areas and 4 levels of responsibility. The mission statement for employee well-being is to inspire and cultivate a workplace culture where we care for one another, each individual experiences personal and professional fulfillment, and employee well-being is a foundational priority. The vision statement is Mayo Clinic models a values-aligned culture where all individuals have the support necessary to thrive, providing compassionate and exceptional care for our patients and each other. These are foundational value statements for well-being across the organization, and they are a North Star for efforts across the organization to integrate well-being into leadership, into policy, into every decision-making process at the organization. The 5 key strategic focus areas were viewed through the lens of what employees should expect to experience as employees at Mayo Clinic. And so these include a healthy work environment, personal enrichment, community, being valued, and meaningful work. These are experienced and influenced at multiple levels of responsibility as well. So individuals, teams or work units, leaders, and Mayo Clinic as a whole. How this model gets implemented to effect change is the next step in the evolution of this, which will be moving forward in the next several years. But initially, this framework allows us to develop a matrix of solutions where each focus area can be mapped against 4 levels of responsibility so that any initiative to promote well-being can be allocated to one or more of those intersections in that matrix, which allows an assessment of where an organization is strong and where an organization has areas of additional opportunity to build new solutions. That also allows local working groups or individuals to highlight which dimensions of well-being they would personally like to focus on most, and they can then tap into that matrix of solutions to pull out resources that are more specifically relevant to that focus area and that level of responsibility. There are metrics that are outlined in our manuscript in greater detail to assess outcomes for well-being initiatives that map to the focus areas and the levels of responsibility. And there's also a framework for how this can be augmented even further to make sure it is sustained as we embed these principles into the processes of an institution. The overall summary hope here is to further emphasize something that leaders across healthcare increasingly understand, that healthcare employee well-being is critical to our ability to meet our mission in serving our patients. We can augment existing evidence-informed models by making sure that we have embedded the voice of staff so that what they need is integrated into these external models in a way that becomes deeply relevant to an individual organization. This approach also allows modifications at an institutional level so that well-being structures can be aligned in the best possible way with site-specific healthcare professional needs, as we all continue to aspire to creating learning and working environments where all of our healthcare professionals can move beyond distress and burnout and thrive and flourish in the deeply meaningful work that we all do.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.